Hey everyone, welcome back and you're watching your medicine channel MMS, which makes medicine simple. Yes guys, medicine is fun if you make it simple. So once again we are continuing our rheumatology series of lectures, and today we will talk about epidemiology and etiology of osteoarthritis, also known as degenerative joint disease. So primarily it's two types, primary osteoarthritis and secondary osteoarthritis. So primary osteoarthritis is the disease of elderly patient, right? It's a disease of joint use. It's a biomechanical problem. It's a wear and tear problem, right? So as we discussed before, that here is the picture of one of my beautiful osteoarthritis patients. She came to my clinic. I asked her name, but she was not in condition to tell her name. Then she was diagnosed with osteoarthritis, and since also she is 60 plus, so I called her osteo women. Ma'am, you are osteo women. So now let's begin with the osteoarthritis. Since osteoarthritis is a joint disease, so let's talk about the basics first. So we have cartilages that contain type 2 collagen. So how to memorize this? Cartilages, this is cartilage, but some people, the idiot like me, they call it cartilage, cartilage. Cart2 means type 2 collagen. We have hyaline cartilage that is flexible and resilient, elastic cartilage that is highly bendable, and fibrocartilage that resists the compression and tension in the joint. After cartilage, let's talk about the bones. So bones have type 1 collagen. So how to memorize this? Osteoclast cut or break the bone. So break the bone, B1, break the bone. 1 means type 1 collagen. So we have lamellar, the strong one, and the woven, the weak one bones. Woven bones are either pathologic or immature. So forget about this. Now talk about lamellar, the strong one. We have cortical, the compact, the dense part, like the outer cell of one vertebra, that gives the strength to the bone. Also the cancellous bone, the trabecular, the inner part, the spongy bone, right, that gives the flexibility. So this is somewhere your compact, your hard bone. This is your spongy, the trabecular, and this is somewhere your cartilage, the firm part, right? So firm, spongy, and hard, compact part. This is how one joint is arranged. So after cartilage and bones, let's talk about the joints. So we have fibrous joints, we have fibrocartilaginous joints, and we have synovial joints. So when we talk about the fibrous joints, here the bones are connected by a fibrous connective tissue, but no cartilage, right? Also there is no joint cavity, and they are immovable or slightly movable, such as sutures, right? So here are two bones and they are connected by dense fibrous connective tissue, right? That's why they're known as synarthrosis. Syn means same, arthrosis means joint, same joint, right? Fibrocartilaginous joints. So here the bones are united by one cartilage, though they lack a joint cavity and also with limited movement, such as pubic symphysis and sacroiliac joint. So here are two bones and they are connected by one cartilage and known as epiarthrosis. Lastly, let's talk about the synovial joints. They have the fluid-filled cavity, right? And also the ends of opposing bones are covered by hyaline cartilage, right? With a wide range of movement. Most of the joints of extremities are synovial type. So here are two bones, and both the ends are covered by one hyaline cartilage, right, separate cartilage, and known as diarthrosis. So now how we can define osteoarthritis? So osteoarthritis is a non-inflammatory biomechanical degenerative joint disease in which all the structures of the joint have undergone pathologic changes. The pathologic process of the disease is hyaline articular cartilage loss, present in a focal and initially non-uniform manner, right, which is accompanied by increasing thickness and sclerosis of the subchondral bony plates by outgrowth of the osteophytes, the bony spurs at the joint margins, stretching of the articular capsule, mild synovitis in many affected joints, and lastly weakness of the muscle bridging the joint. Please also remember that osteoarthritis is the most common joint disease in elderly and especially females. Now let's talk about the classification of osteoarthritis. So primarily we classify it primary osteoarthritis and secondary osteoarthritis. Primary osteoarthritis, also known as idiopathic, so break the word idiopathic, idiot and pathology. So we doctors are idiots and sometimes we cannot find out the pathology and then we silently name it idiopathic. So there is no predisposing cause, occurs spontaneously and usually associated with aging, like in elderly patients. Secondary osteoarthritis occurs due to predisposing factors such as trauma, including the accidents, sports, and occupational injuries, right? Congenital abnormalities such as congenital disorders and developmental defects, repetitive stress because of some occupation and sports, metabolic disorders, Paget's disease and alkaptonuria, endocrine disorders such as diabetes and obesity. Please take a note, obesity is the major risk factor for osteoarthritis. Also the other joint disease such as rheumatoid arthritis, gout and SLE. So now let's talk about the risk factors for osteoarthritis, and these are intrinsic joint vulnerabilities that affect the local environment of the joint such as previous damage, muscle weakness, increased bone density, malalignment and proprioceptive deficiencies. Also the systemic factors that affecting the joint vulnerabilities such as increased age, female gender, some race and ethnicity, genetic susceptibility and nutritional factors. So put together these two, they increase the susceptibility to develop osteoarthritis. If patient is having obesity and occupational injuries along with these two, then definitely this patient will develop osteoarthritis or its progression, right? So please take a note that the risk factors written in green like previous damage, malalignment, obesity and occupational injuries, these are the modifiable risk factors for osteoarthritis, and obesity is the number one major risk factor for osteoarthritis. So now let's talk about the epidemiology of osteoarthritis. So as we already know that this is the most common joint disorder, especially in elderly and females. Also symptomatic knee osteoarthritis occurs in 10% men and 13% women aged 60 years or more. Number of people affected with symptomatic osteoarthritis likely to increase with age and obesity, right? As we know that obesity is the major risk factor for osteoarthritis. Also please take a note that osteoarthritis is common in women than men, common in elderly than young, and common in blacks than white, except the osteoarthritis of hands that is common in whites than blacks. So thank you so much for watching, and please do subscribe the channel to get all latest videos like this, and also help this beautiful osteoarthritis patient osteowomen to reach and teach more and more people like her about this nasty disease osteoarthritis. Stay safe, stay healthy, study a lot. Wishing a very happy new year guys. Thank you so much.